effective against the UK variant. In South Africa, where another variant is spreading, Novavax says that vaccine was 60% effective. That South African variant of the virus was just now identified here in the United States. 2 people in South Carolina recently tested positive. Now, they're strangers. They don't know each other. They haven't traveled anywhere, so it's unclear where they got it from. But there's concern this variant is more transmissible and could evade immunity offered by antibodies. The CDC says there is no evidence the strain causes more severe symptoms. It's a lot of information to take in. Dr. Ernst von Schwarz, a medical researcher and cardiologist, is joining us tonight for some insight on these new variants and what role these vaccines might play. So will they, as we've been told for the last month or two, still be effective on the variants we know about at this point?
Well, that's a great question, Jared. Thanks for having me on. First of all, both companies, Pfizer-BioNTech as well as Moderna, made statements within the last days stating that their vaccine is effective against the UK variant, but also now against the South African variant, which is called B1351, but less effective than against the original COVID-19 virus. So what they did basically is they did studies in the lab. These are not clinical studies, but they used blood of patients who received the vaccine and exposed that blood to synthetically engineered particles which resemble, for example, the South African mutant, and then showed that the vaccines, on one hand, do have efficacy, meaning they basically protect and they can build antibodies. But if you look at the absolute number of antibodies, they're actually 6-fold reduced, at least for the Moderna vaccine, compared to the older version of the COVID virus. So that means that those patients still have enough antibodies to kill the virus and prevent the severe disease, but not as effective as against the original strain.
What degree of efficacy should we be looking for? We mentioned the Novavax, which hasn't been approved yet, but they're in trials. It's 95%, 85% against the other strain, but then 60% effective, they said, against this strain from South Africa. 60% is still pretty good, right? It's not great. It's not compared to the others, but it's not.
Yeah, that's definitely not enough. I mean, keep in mind that the pharma concern Merck just basically dropped out of the race on the vaccines because even though their developed vaccine was well tolerated, it just created efficacy in approximately 60%. So they did not even go forward with that and marketed it because that's not enough. We want to be beyond 85% efficacy if we expose a large portion of our population to the vaccination.
Doctor, what should be our biggest concern right now? That these new variants are more contagious, or that the vaccines that we have and that are in the works might not work so well on them?
Well, even if they might not work that well, both big companies, Pfizer-BioNTech and Moderna, have announced that they're working on possibly a booster shot several weeks after, which will be adjusted to cover whatever mutation will be found in the future. And keep in mind, we are not at the end here. I mean, there will be more mutations found within the next couple of weeks, of course. So the other issue is, of course, even though if we can prevent disease, we might not be able to prevent transmissibility. And those newer mutations, especially the South African one, as you mentioned, might have a much higher transmissibility than the older one. So we might not get the disease, but we might still be able to be contagious and transfer the disease to others who are not vaccinated. That's why we have to stay on the masks and the social distancing.
Yeah, for months to come. And really quickly before we let you go, you mentioned a booster shot. So that would be a third shot beyond the 2, or like a yearly booster?
Well, a booster will probably be several weeks after the second shot. But whether or not we need seasonal, meaning yearly vaccination like for the flu, we don't know, but we might.
Yeah. Dr. Ernst von Schwarz, we always appreciate your time. Thanks so much.